insurance companies more leeway to raise premiums and deny care. So the bottom line is, I don't believe we should give government or insurance companies more control over health care in America. I believe it's time to give you, the American people, more control over your own health insurance. And that's why my proposal builds on the current system, where most Americans get their health insurance from their employer. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. But I can tell you, as the father of two young girls, I don't want a plan that interferes with the relationship between a family and their doctor. So we're going to preserve that. Essentially, my proposal would change three things about the current healthcare system. Listen up. First, it would end the worst practices of insurance companies. It would end the worst practices of insurance companies. Within the first year of signing health care reform, thousands of uninsured Americans with pre-existing conditions would suddenly be able to purchase health insurance for the very first time in their lives, or the first time in a long time. This year, insurance companies will be banned forever from denying coverage to children with pre-existing conditions. This year, they will be banned from dropping your coverage when you get sick. And they will no longer be able to arbitrarily and massively hike your premiums, just like they did to Leslie or Natoma or millions of other Americans. Those practices will end. If this reform becomes law, all new insurance plans will be required to offer free preventive care to their customers starting this year, free checkups, so that we can catch preventable diseases on the front end. Starting this year, there will be no more lifetime restrictive annual limits on the amount of care that you can receive from your insurance companies. There's a lot of fine print in there that can end up costing people hundreds of thousands of dollars because they hit a limit. If you're a young adult, which many of you are, you'll be able to stay on your parents' insurance policy until you're 26 years old. And there will be a new independent appeals process for anybody who feels they were unfairly denied a claim by their insurance company. So you'll have recourse if you're being taken advantage of. So that's the first thing that would change, and it would change fast. Insurance companies would finally be held accountable to the American people. That's number one. Number two. Second thing that would change about the current system is this. For the first time in their lives, or oftentimes in a very long time, uninsured individuals and small business owners will have the same kind of choice of private health insurance that members of Congress get for themselves. If it's good enough for Congress, it should be good enough for the people paying Congress's salaries. That's you. Now the idea is very simple here, and it's one. I'm sorry, go ahead. Let me explain how this would work, because it's an idea that a lot of Republicans have embraced in the past. What my proposal says is that if you aren't part of a big group, if you don't work for a big company, you can be part of a pool which gives you bargaining power over insurance companies. It's very straightforward. Suddenly, just like the federal employees, there are millions of them, so they can drive a harder bargain with insurance companies. You, as an individual or a small business owner, could be part of this pool, which would give you more negotiating power with the insurance companies for lower rates and a better deal. All right? Now, if you still can't afford the insurance that's offered, even though it's a better deal than you can get on your own, but you still just can't get it, then what we're going to do is give you a tax credit to do so. And these tax credits add up to the largest middle-class tax cut for health care in history. Because the wealthiest among us, they can already afford to buy the best insurance there is. The least well-off are already covered through Medicaid. It's the middle class that gets squeezed. That's who we need to help with these tax credits. That's what we intend to do. Now I want to be honest. Let's be clear. This will cost some money. It's going to cost about $100 billion per year. Most of this comes from the nearly $2.5 trillion a year that America already spends on health care. It's just that right now, a lot of that money is being wasted or it's being spent badly. So with this plan, we're going to make sure that the dollars we spend go to making insurance more affordable and more secure. So I'll give you an example. We're going to eliminate wasteful taxpayer subsidies that currently go to insurance and pharmaceutical companies. They are getting billions of dollars a year from the government, from taxpayers, when they're making a big profit. I'd rather see that money going to people who need it. We'll set a new fee on insurance companies that stand to gain as millions of Americans are able to buy insurance. They're going to have 30 million new customers. There's nothing wrong with them paying a little bit of the freight. And we'll make sure that the wealthiest Americans pay their fair share of Medicare, just like everybody else does. So the bottom line is this. Our proposal is paid for. All the new money generated in this plan goes back to small business owners and individuals in the middle class who right now are having trouble getting insurance. It would lower prescription drug prices for seniors. It would help train new doctors and nurses to provide care for American families and physicians' assistants and therapists. I know they've got great programs here at Arcadia. I was hearing about the terrific programs you have at Arcadia in the healthcare field. Well, you know what? We're going to need more healthcare professionals of the sorts that are being trained here, and we want to help you get that training. And that's in this bill. Now, so I've mentioned two things now. Insurance reform and making sure the people who don't have health insurance are able to get it. Finally, my proposal would bring down the cost of health care for millions, families, businesses, and the federal government. As I said, you keep on hearing from critics and some of the Republicans on these Sunday shows say, well, we want to do more about cost. We have now incorporated almost every single serious idea from across the political spectrum about how to contain the rising cost of health care. Ideas that go after waste and abuse in our system, including in programs like Medicare. But we do this while protecting Medicare benefits, and we extend the financial stability of the program by nearly a decade. Our cost-cutting measures mirror most of the proposals in the current Senate bill, which reduces most people's premiums and brings down our deficit by up to $1 trillion over the next decade because we're spending our health care dollars more wisely. Those